And did you have any like experiences that you wanted to share about during your undergrad?
Yeah, during my undergrad, I think right before my senior year, after I had declared global studies as a major, after I had declared public health as a minor, I did a study abroad program in Tanzania for the summer, right before my senior year. And this program was focused on medicine and public health in Tanzania. So looking at their healthcare systems. This included us going to like a training site and sitting in on various lectures by a pediatrician and then also a health advocate. And then as a part of this course, we also did site visits to a pharmaceutical dispensary. We were able to tour maternity wards. And then I also got to volunteer at an orphanage where there were, majority of the children had parents who had passed away to HIV/AIDS. And as a part of that program, it really kind of honed in my passion for global maternal health and bringing, what I learned through that experience to my future careers. And I think that is why most of the positions I've had have been geared towards improving the health and well-being of families and children, kind of seeing that like firsthand experience.
And how did you develop maybe that interest for maternal health at this point? Was there any incident or anything that like how did that come up for you?
Yeah, I think visiting the maternity ward and seeing similar issues that these mothers were facing, many who maybe wouldn't even survive past the age of like 40 because they were HIV positive or because of lack of resources. They were in a very low resourced area. This was in a rural setting. And that really, that sat with me very heavily. It was an issue that I wanted to solve, but at the time, being in my late teens, early 20s, I didn't have the right tools to be able to solve it. And that kind of inspired me to go on this journey of gaining more education, gaining more knowledge, building my resource reserve so that I would have something to offer and that I could have the capacity to potentially solve some of these issues. I think that all kind of culminated in why I chose this path and why it's something that I hope to continue pursuing as my career develops.
And were there any big undergrad takeaways that you wanted to share with us?
I think that was the biggest one for sure. And then just, bit of advice to undergraduate students that they don't necessarily have to have everything figured out all the time. It's a process of learning. That's why, they're there in a university or college setting. It is an opportunity to really kind of step outside yourself. That's how I like to think of it. Like step outside yourself and view the world as like third person perspective. You have all of these options in front of you. You have the ability to reach out to so many different professionals, even, coworkers, classmates, whether you have a part-time job, you have people in your class. There are some people from a very young age who know exactly what they want to do. And then there are people like me who took a little bit of time to get to where they are. So just be open and honest with yourself. If you don't really know what you want to do, take a little bit of time to explore and ask yourself those questions.
Yeah, absolutely. Plus one to that. What was your job after you graduated undergrad?
My first job was at a community clinic. It was a community university healthcare center. And at that position, I was a front desk patient services representative and then also a MinSure navigator. So I would help patients, appointment scheduling, making sure that their appointments across the different departments of the clinic were in sync, if they had medical, dental, or physical appointments, and then also helping people apply for insurance and then helping them triage any issues they had with their insurance.
Okay. And then were you in the role as an educator consultant?
I moved from that position at that point, I had transitioned from working at the clinic to Hennepin County. And at Hennepin County, I had two different positions at two different times. Initially, I started off as a community health worker and regional coordinator doing immunizations outreach. A lot of the work I did was working closely with other jurisdictions in the metro area, looking at immunizations rates for childhood immunizations, and then doing outreach to community to help kind of increase those immunization rates and where we had pockets of disparities. And then after that role, I transitioned to another position within the county as a senior planning analyst, and this was in the public works department. That position, that was my first kind of exposure to managing grants and contracts that were going to community, and also experience working with clinical data. So looking at lead poisoning prevention results from children and being able to kind of work with community organizations so that they could craft programs to work with those communities that were experiencing this disparity the greatest.
Maybe how did you overcome if there was a learning curve around managing grants and doing that type of work?
Lots of trainings. How do you manage a budget? How do you do financial audits? And then also asking a lot of questions and working closely with the community to learn more about what their internal processes were. A lot of these were local nonprofits or community boards. So just asking a lot of questions and leaning on coworkers who had previous experience with this work, what their best practices were. And I'm a very process-oriented person. So just making sure that I had a good understanding of what the processes in place were. And then also looking for opportunities to improve those processes.